so that we can save this and watch later. So let's get our slides ready to go. And how is everybody tonight? So let's see if we can use the chat. How's everybody feeling tonight? How's your day been? It's a Tuesday. Hey, Matt. Hey, Joanna. It's a Tuesday after a holiday. Kind of crazy to jump back into things today. Was everybody overwhelmed with inbox messages if you work in the clinic? Hey, Ginger, what's up? If you're on Facebook with us, also say hi. We are so excited to get started almost. Hey, Esprit, what's up? Just saw Esprit. Jess is doing fantastic. Munya, hello. It's been a while since we've seen you. But I'm glad to hear you guys are doing great. So happy Memorial Day weekend as we're wrapping up. Hey, from Miami. Hey, Alejandro. I think there's a hurricane coming your way, but be safe is the moral of that story. Okay, speaking of, hey, Mercy John. So, hey guys, speaking of hurricanes, we're gonna bring it tonight. Like a hurricane. Hey, Nuria, it's nice to see you. Hey, Nikki from Detroit. Where do I get the workbook? Good question. Tori, I wonder if Tori's on with us. Let's see if she's on. She normally gets the workbook for you guys. If not, Michelle, are you able to grab the link and post it? I just put it into the featured posts. Perfect. So yeah, welcome in. So yeah, definitely let us know how you're doing. We're excited. And I'm going to go ahead, and now that we're 5:30 on the dot, I'm going to go ahead and kick off the session so that we can get started. We have 12 people on Facebook. You can join us on Zoom if you want to do a any sort of chatting. You can also join on Zoom. And we're going to get started. So officially, welcome into the 5-day EKG, or the 3-day, sorry, it used to be 5 days. Thank you. Ruben is posting in the Facebook feed for us, and I think Michelle's going to grab the link for us as well. So we are, yes, thank you for putting the link in. Just to let you guys know, when you click this, it goes to the messenger and it sends it to your messenger inbox. It's an automatic thing. It also gives you reminders if you need reminders. So hopefully you guys saw that. So what we're going to do tonight is we're going to cover some EKG foundations and EKG terminology. And what this is going to do is just going to give you some nuts and bolts if you're new. And if you're not new, it's going to give you a new twist on things and maybe just a review, right? Because review is always good. Now, I do have the winners. We've been holding a contest like this whole month, and we have, hey, Michelle in Georgia. What part of Georgia? Tell us what part. Hey, there's Tori. So the winners, I'm so excited to announce, we had a contest where it was an invite your friends contest. And no surprise here, Yvette Woody, if you're on, you basically annihilated the contest and you won the EKG workbook. Okay, so this comes with a badge, actually. So this gets mailed to you, Yvette. So I'm pretty sure I have your address, but make sure you message me. So this little basic arrhythmia workbook is your prize with the badge. So congratulations, Yvette. I also just wanted to say a quick shout out to Cheryl because she did a great job too. So Cheryl, you are actually winning one of my custom paintings. It's an original. FYI, you guys, I recently got approved to be one of the artists in San Francisco, debuting in a gala next year. So literally get my art now while you can, because then the value of the art's going to go up. So Cheryl, you get this painting right here. So excited to send it to you. And then Amy, you're the third winner. You get this painting. Okay, so these are all custom hearts, of course. And our last winners, last but not least, Eddie and Jean, you guys are both winning our cat badge. Okay, so I'll send these out to you in the mail. I just need all of your mailing addresses. So congratulations to the winners. That was so fun to see you guys all inviting your friends. Yeah, it's super exciting. I know. So then other housekeeping business, I just wanted to, thank you, Michelle, by the way, share this EKG with you, because in this month in the Facebook group, I've been dropping little hints, little quizzes every day for like the last 2 weeks to get you ready for this. This is one of the things I promised you we would go over. We are not going to go over it tonight. We're going to go over it the last night because we're going to be doing basic 12 lead. which is Thursday. Also, speaking of Thursday, you are going to get our session like this is going to get kicked off by Coach Michelle Barkley, who said hi earlier. She is our co-hostess of this challenge. She is an amazing cheerleader in this group, and she's one of the lead instructors. So she's going to kick it off with a game, and she always makes things really fun. So we'll do a game, and then we'll do the basic 12 lead, including this EKG. I'll give you the answer, but I want you to at least think about it. For those of you who have some EKG background, what would you do? And because we're going to basically talk about this later. Now, questions we get a lot are, and I've been getting them all day in Messenger. Jen, oh my gosh, I'm going to be at work, or it's too late for me because I'm on the East Coast. Can I watch this later? And absolutely, you can watch this later. It'll be recorded and it'll be stored in the Facebook group under guides. So there'll be a day 1 guide, day 2 guide, day 3 guide, so you can rewatch the things later. So don't feel like you have to get it all in tonight. That's okay. And then where can I get the workbook? We're putting that in the chat for you right now, both Facebook and Zoom. And then are there any guests? Well, I already mentioned one of our guests who's very special, Michelle. But tomorrow night, we're having another guest. If you've seen him before, then you know how much fun he can be. That's Gary, who's going to be doing an Rhythmia workbook type of thing for us. So he'll be doing a review and kind of testing us on some very dynamic arrhythmias. And that's always a good session. So that is the only session. Mark this down somewhere. Tomorrow night, it's a bonus, okay? It's at 6:15 PST. So just add 3 hours on if you're East, 2 hours if you're Central, 1 hour if you're Mountain. That's the session that he does not allow recording. So you have to make it live if you want to see it. It's not mandatory. None of this is mandatory, which is the great news, right? It's just fun if you want to do it. If you miss this one for any reason, just don't worry. We usually have them on each challenge, so you can come get them the next time. So if you can make it, great. Otherwise, catch them another time. No worries. This is him. You might have recognized him here. He's going to do a Rhythmia review tomorrow at 6:15. So it'll be basically after my session. Same Zoom link, just to make things super easy. P.S. The Zoom link is the same all 3 nights to make that easy for you as well. Hey, KJ. And KJ saying hi to Remington. Remington is our EKG reading German Shepherd PS, who you'll see throughout the challenge. Okay, now last bit of more housekeeping, but this is a scholarship that I just want to put it out there right away that we're going to be offering on the night 3. We're going to be giving away 1 spot, okay, 1 scholarship. So I want to tell you now how you can position yourself to win this, because you're going to learn in this 3 days with us a lot of things, but it's also going to open your eyes to like, oh my gosh, I actually need to know so much more EKGs, and I want to go the full distance and learn the things with people that support me and encourage me. So you're going to want to join us. But if you want to win a free spot, okay, this is how you're going to win. Now, KJ's on here. She won last time because, you know, what we're looking for is for community. We're looking for the person who goes out of their way the most to help your fellow students in this course. There's 18,000 people, I think, in this group now, right? So it's a lot of people for me to personally get back to. So if you see someone who's like struggling in the group, like I need the workbook, get the link to them, right? If we don't do it first. If you see someone who's like, hey, I'm having a hard time finding the live, help them find the live. If you see somebody who says, oh, I'm really scared, I'm really nervous, like go cheer them on, because that's what this group is. So I want to reward that, and I will reward the person who does it the most. So I'm going to be watching your comments. I'm going to be watching how you act with each other. And really, we want to support you, but want you to support each other too as well. And so this is my dad. He passed away last year, and I'll be giving away a scholarship in his name to someone who's so helpful because he was so helpful. So it's a great way for me to honor him. It's a great way for you to win some fantastic knowledge. And I'll tell you more about that. But that's how I'm going to be picking the winner. And I'll announce the winner on night 3. We love to give away prizes in this group in case you haven't noticed. Okay, so what are we covering tonight? We are covering these things, okay? Normal conduction, normal EKG, 10-step system, the waves. We're covering all that in the challenge, but tonight we're going to focus on the waves, okay? So we're starting with baby steps. And hey, what's up, Dana? I haven't seen you in a while. Hey, Michelle, also hanging out with us on Facebook. So who's in this group? I just mentioned a couple names. Michelle's a medic, right? Dana, I think you're an NP or PA. Hi, Lynthia. So there's people of all genre. There's EKG techs, there's students, there's paramedics, there's MDs, like you name it, there's someone in the group that is, you know, doing your job class, right? There's even, I mean, it's just crazy. Oh, hey, Kamal, what's up, Kamal? How's it going? So literally there's someone of every workplace position, and we're all just one big team is the moral of that story. And if you're a student, drop which one you are. Michelle's a new MP. Oh, you're in the right place. You're going to get a lot of knowledge and bang for your buck, which is free, which is even better. But we have a team here, and so you may have seen David White. He's been popping in and out on the comments today, tagging people, but he's basically, just between you and me, the smartest guy I know in EKGs. And if you ever see him comment on anything in our group, and I'll tag him all the time, literally look at his answer because it is right, like just hands down. And then we have Megan, our cardio queen, who sometimes pops in too. She does all things cardio. She teaches in our 30-day group. Both of these folks do. And so does Michelle. She's our community manager for every group we have. And she's also rocking her zebra shirt here, and she teaches with me live as well. And so, yeah, it's really great. So Latanya's an NP. Alejandro just graduated from NP school. Suri from Texas, we have student, yay. And invite your student friends. Definitely. Oh, we have NP. And just a little side note, getting off topic for a minute. If you really want to firmly understand what we're teaching you, teach it to somebody else. Like go to somebody, NP, what's up, Nicole? So go and be like, hey, guess what I learned in this class I took last night? Let me show you. And then when you actually process it, you'll actually really learn it. Okay. So if I haven't met you, I'm Jen. I'll be your hostess for the challenge. And I am a PA of 16 years. I work both emergency room and cardiology. I have worked urgent care, and I have worked primary care for about 3 months. That's all I could do. Primary care is so hard. But also, yeah, we have Tori on our team as well. You're seeing her in the comments. She is somebody that is also our concierge of the group. So if anything like comes up where you're like, hey, where is this? Where can I find this? Ask Tori, Michelle, or I. We are your connections. So I also lecture. In fact, I just got back from Chicago. Esperi was there with me teaching. It was amazing. And then I also am going to Pensacola next week to teach live in person for 11 hours, actually. So I do a lot of on the road teaching, and then work cardiology as well. So I have a lot of background, but I was a paramedic previously. So I can draw from lots of different knowledge bases to help teach you. But what I wanted to teach you most, right, is how to get good. Hey, what's up, Matt? Yeah, so you graduated in November. I know, Tori, it would have been great to see you. We had Chicago pizza, deep dish, which was an experience. But anyway, how do you learn EKGs? Okay, how do you learn EKGs? Well, the first thing you have to learn is, what is an EKG? We'll talk about that today. What can it tell you? We'll talk about that too. What are the waves? That's going to be tonight. And what does normal look like? The heart anatomy and how it corresponds to the EKG. The 4 parts of the heart we're actually looking at. We'll do that all tonight. Tomorrow, we're going to do arrhythmias, which is step 6. Step 7 is the 12 lead, right? Where we're going to basically kind of break this down a little bit on what the 12 lead looks at. And we'll talk about some of the terminology we use for that. And then what normal is, so that you can build on that. On day 3, and this is in your workbook, the last pages we'll do, we're going to practice a 10-step system if you don't have one. Okay, so the rest of the stuff, this 10 through 15, this is the stuff that we cover in the 30-day EKG challenge. So basically, we get you started in the 3-day. We give you a super solid piece of a foundation. And then if you want to take it further, you come with us to learn. There's some new stuff that came out recently about STEMI equivalents that we need to know. We teach you all those things. We teach you the things that can bite you, so you don't get in trouble as a provider. We also teach a lot of other things, like how to interpret stress tests, how to do triage messages, how to do differentials, how to document to keep yourself safe. Like, yeah, there's so many things, but we'll talk about that later. In the meantime, I do want to just give you proof that one time, yes, this is me, I was a paramedic. I was looking confident, but terrified, because I was very new. And this was my nice EMT partner, Frank. Never forget him. He pepped me up, gave me the pep talk, right? You could do this. This was before technology, before you could actually send EKGs for interpretation. So I realized, oh, this is all on me, right? And I became afraid, but it was that fear of not wanting to miss something, of not wanting someone to die because I missed something, that drove me to figure out a system to learn 12 leads. Because what I ended up doing, and I'll just tell you what I did. So it was late at night. I couldn't sleep. It was a 24-hour shift. I was sitting in that cabana that's right on the right. And I was like freaking out that I was going to miss something. So I said, okay, let me attack this backwards, right? Like tonight, how can I get myself to sleep? So I realized that it was too much to learn everything all at once before I was tired and sleepy. So what I did was I wrote down a list of the things that could kill people if I missed it. It was a list of like 10 things. And then what I did the next day on my day off is I spent the whole day learning those patterns of the things that the machine would miss, but would kill somebody. And once I had that list, I was like, bam, okay, good. Now I'm not going to miss those. And I felt like I could breathe, So that's how I came up with how I teach these courses. And I teach the people those things now so that they also cannot stay up late with anxiety, right? Because I know that was definitely me. So let's get into it and get into our knowledge now and talk about the first thing on there, which was, what is an EKG? So that's the thing that's really confusing, because we have a flat piece of paper that is representing a 3D object. And my friends, that is where half of the problems come from, because we have a disconnect there. But what we teach, especially what Michelle teaches in our 30 days, she teaches us, she gives us hands-on demonstrations on how to memorize this. But I'm just going to really quickly give you a system on how to remember what the heart is looking at, or the EKG is looking at, and what is actually the 4 layers of the heart, because that was also on the list. Not 4 layers, but 4 things in the heart. So this, and feel free to steal this speech. I give this speech, I feel like, at least once a day in cardiology, because what'll happen is people will say, I'll say, okay, so they'll come in with chest pain and palpitations. Let's just say this is every day. So I'll say, okay, cool, chest pain. So we're going to get a stress test, and you have palpitations, we're going to get a monitor. And because you got chest pain and a little edema, we're going to get an echocardiogram. Routine things. But people will say, and I do not blame them at all, okay? They'll say, oh, well, I have one heart. Why are you getting 3 tests? Why can't you just do 1 test? That seems a little like overkill here. Like, yes, totally agree. But with the stress test, I can see your plumbing of your house. The heart's like a house, right? I can see your plumbing. That's why we call interventionalists, the guys that put stents, we call them plumbers affectionately, and they love it, right? So that's the vessels. Electricity, we have our electricians who are electrophysiologists, and they love being called that. They're like, yes. And that's what we're looking at with the EKG, is the conduction. So the heart, the muscle, is putting off basically electricity to the chest wall, which we capture with the EKG and the paper, and we're basically like looking at the signals the heart is sending us to interpret what's wrong with these 4 things. Okay, that's the foundation right there. So once you understand that the heart's just trying to talk to you, it's just sending you signals, you just have to interpret the signals. And guys, it's like learning another language, which is why we're doing EKG terminology today, so that we can learn how to speak the heart's language. So then we're also looking at the echocardiogram, right? And that would show us the walls of the house or the muscle, but it also shows us the doors, the valves. Do they open well? Do they close well, right? Open and close. That's what we're looking at. I think my dog is here. Sorry. Hi, Remy. So that's kind of what we're looking at. And then the other part of this, concept check wise, is the size of the waves, okay? Because a lot of tissue puts off a big wave, R wave, right? And not a lot of tissue or heart failure, or things like amyloidosis, or things like pericardial effusion, or things like myocardial infarction, they can cause the R wave to be small. So can obesity, so can COPD. Anything that gets in the way of the signal going to the chest wall to be picked up is a low voltage situation. So if you understand that, then you also understand maybe how much muscle is down in the chest by the size. Now, that's not always true because sometimes, you have an athletic heart and that throws things off. It's not always bad if you have a lot of voltage, but it's usually bad. So understanding that, and then understanding that what we're talking about here, I brought an EKG just to show you low voltage. You can see that we're talking about the R waves. Okay, so they should be taller than that. And there's voltage criteria. You can look it up if you want to memorize it, but the machine will usually do a pretty good job at picking this up for you. But anyway, here's the way to remember it. So if you think about the complex here as a family, okay, this is what I think is so helpful for lots of things, including heart blocks. So this here is the P, this is the R, this is the T, okay? So they are a family. This is the P. This is my awesome writing with my mouse. P, Q, P. Oh gosh, you guys, I'm so sorry. I can't even write R. P, R, T, okay? So the P is like the mom, the T is like the dad, or sorry, the R is like the dad, and the T is like the baby. So mom, dad, baby, they should always be holding hands, and the mom should be small, so should the baby. The dad should be tall. This actually is a really important thing to learn because if the T wave is really big, it can mean things like hyperkalemia, right? It can mean ischemia. So the size of the T wave, as it turns out, is really an important part of the story. And then the R wave, it needs to be tall enough, but not too tall, not too small. It's like a Goldilocks story, right? Remember how she goes in and she's like, oh, this porridge is too, like, not warm, and this porridge is too hot, right? You want the just right porridge. So learning that is going to be super helpful for you to understand that concept. And thank you, Tori, for putting that in. I really, really appreciate it. So low voltage is bad, and you would want to investigate. It could be something benign, but you always think worst first. So if you're new to medicine, as a lot of you are students here, always go into and approach things as if the patient has the worst thing first, because then you'll never get burned. That's a little extra pro tip. So understanding that the conduction, what's happening in the heart, and I believe you have this graphic in your workbook. If you wanted to do this, you could go over here and you could say, hey, this is the sinoatrial node, and you could just color that in. You could go down to here and you could say, hey, this is the AV node. And then this is the bundle branches right here, okay? Bundle branches. And the bundle branches coordinate together to do the squeeze of the heart so that the blood flows appropriately. So you can imagine that, when there is a block in a bundle branch block, the electricity goes around and it makes the QRS wide. But understanding that this is the president of the heart, the SA node, it runs the heart, understanding that if this was annihilated for any reason, the AV node would take over and so on and so on. Okay, so this is a super fun thing to practice on. And then understanding that you're looking at basically electrical events here. Okay, electrical events from the conduction, and it's from that we ascertain what is happening. Okay, so we'll talk more about that in the 12 lead, but let's do something fun. I want you guys to participate. I want to basically see your comments. And I want you to just to do it really fast. Okay, let's see who our fast typers are. Okay, you're going to put in the chat, what is this wave? Yeah, the P wave. Good. Okay, what is this wave? Type it really fast, really fast. This here is the Q, right? Okay, this is the R. Oh, you guys are so fast. Look at you go. This is the, yeah, this is the S wave. This here is the, oh, you guys are so fast, the T wave. And finally, the last one, let's see if you guys get that. Let's see. Oh, yeah, look at how fast you guys are. Okay. Yes, everybody got it right. The U wave, exactly. Okay. U wave shouldn't be there. I'm loving seeing your comments on Facebook too. You guys are awesome. So the U wave shouldn't be there. And ultimately, the size of our waves matter, right? Small, big, small. And then this guy just shouldn't be there. So let's talk about a few more rules. You put it all together. Exactly. Exactly, Michelle. See, this isn't that hard, right? So in a nutshell, a couple more rules, right? For the mom, she should be smooth. The way I remember this, like she shouldn't be notched because that actually means problems. But the way I remember that is as a mom, I'm a fur mom. It's still a mom. I want my complexion to be smooth. It's a silly way to remember it, but that's what I remember. Okay. No pregnant P waves, no notched P waves. The other thing is you don't want your mom to be too close to the dad. Like you don't want your mom to be needy, basically. If she's got her eyes on him, like really close, it could mean Wolf Parkinson's white, which would be bad. Now, the QRS, again, we shouldn't have too tall or too small. We already covered that. That's easy. And then the T wave should be upright in all the leads except for AVR and V1. Let me repeat that. The T waves should be upright in all leads except for AVR and V1. Why does that matter? It matters because when you start getting into this and your T waves are not the right direction, it actually could mean acute coronary artery disease, acute ACS. So that's one of the things it can mean. It can mean a lot of other things too, like pulmonary embolus. So you really need to understand the foundations that what's normal. We'll review that more on the night 3. So the P wave, understanding that the sinus node creates the P wave. And that's what we always want to see. We want to see a beautiful, not notched, very smooth P wave, and the P wave's not too close to the QRS. And that's what makes us really happy. The QRS should be not too tall, not too small, and should be no more than 3 small boxes. Okay, so 120 milliseconds. And sinus makes peak. Yes, exactly, KJ. So no more than 3 small boxes for our QRS. If it's wider than that, we got to worry about things like bundle branch blocks, got to worry about things like hyperkalemia. And then another fun thing. All right, so Payal is having problems with the link for some reason. Tori, maybe you could help Payal. But in the meantime, let's talk about refractory period. So thank you, Michelle, for the recap. I love your recaps. Okay, so here's the thing. This is probably like scratching off some cobwebs from like back in the day, but essentially the T wave goes up, right? In almost every lead. And we want it to be a little uneven, right? A little uneven. And there's a period right here, which is called the refractory period. Now, this is the relative refractory. This is the absolute refractory. And this is just important talking about the T wave, because if you have an impulse that comes in right here, you could have somebody go into something called, does anybody know the name? What's it called if an impulse lands right here accidentally? It's called something phenomenon. Let's see if anybody knows. Something phenomenon. Okay, so, oh, Matt, yes, Matt, our superstar. It is called R-on-T phenomenon, R-on-T, and it leads to something called torsades. Yes, Tim, which is very bad. Torsades, exactly, Michelle and Lynthia on Facebook, okay? So great job. And then let's talk about Q waves. Good job, Tina. So Q waves, we want to look at how big they are and what leads they're in. So if a Q wave is at least a third the height of the R waves, some textbooks say a quarter, then you would need to be worried about it, okay? If it's deep or wide, it's pathologic, meaning bad, most likely old MI, but could be new MI, and actually Q waves can be found in other conditions too, but nobody ever teaches us that. So if they're big or wide, we're worrying about them, keeping an eye on that. So that's basically how you measure it out. You basically chop that, right? You chop it into thirds. And then you can see here that this Q wave is a third, so it would definitely be pathologic, okay? Where we have our eye on that Q. The machine will read Qs as possible inferior infarct, or it'll say something else, but usually this is what it says, or some language variation thereof. But at the end of the day, the machine software is so wicked smart on how to put all of the responsibility on you, because it says, hey, I'm seeing there's an infarct. I don't know when it was, and it can be new. And that's what people never teach you. They always teach you, oh, it's old. Well, not always. They can form within an hour of an MI. And this is what they look like. You can see that in lead 3, this is a Q wave in the wild, right? And there's a little one in EVF. It's definitely a third the height of the R, and therefore it is definitely pathologic. Okay, so this is the definition of a Q. It's bad. Now T waves, we're going to go through these pretty quickly because we just want to talk about some of the variations. This is a mini version of the T wave jail. So basically a normal T should be a little bit leany, a little bit not symmetric. And then a T wave that's really big like this, we wouldn't know what it is. We'd really need to look at the rest of them. But hyperkalemia is a possibility. And so you've learned that in school already. That's not any new news to you, but sometimes it can mean ischemia as well. This one being upside down and check mark appearance. This one is consistent with a big ventricle. So left ventricular hypertrophy. And then this one is very peaky and pointy. And this one is definitely hyper K versus this, which is hypo K, which is super flat. Really big, super flat, hyper, hypo. So literally the electrolytes can affect your T wave. So can ischemia. Lots of things can. This is an example. Thank you, Tori. This is an example of how messed up this whole thing can get. Okay. So this is not meant for you to interpret or know anything about this because this is like the deep end, but I just wanted to show you that, hey, this is so not normal. This is like almost every T wave is misbehaving because remember we said AVR and V1, those two leads, the T waves should be inverted, which is upside down. Every other T should be upright. That guy's not, that guy's not, that guy, no, misbehaving, 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 misbehaving. The only two guys that are actually following the rules are these two on the whole EKG. And this patient ended up having a cardiomyopathy, which was a very really bad thing. But it's the T waves that told the story. So understanding why we're actually teaching you this so that you can pick up things like this is critical. Okay. So there they are misbehaving, as we pointed out, not behaving. And so we need to worry about lots of different things. Now, going back to the R to R interval, we just need to be looking at this because when we do rhythms, which we're going to do tomorrow, we need to know if the R to R is irregular or not, because that's going to help us determine the rhythm. Regular rhythms, things like SVT, things like sinus, versus irregular rhythms, things like AFib, things like sometimes flutter can be irregular. Sometimes PVCs can be irregular. So we need to understand that this is the tip of the R to the tip of the R, and that's something we measure called the R to R interval. We'll be asking you about that tomorrow on our bonus session with Gary and in my session earlier in the day. Okay, let's do a rapid fire again. Let's go ahead and do our segments. So I want you guys to tell me, what is this here? This segment is called the, what segment is this called? This is called the, yes, PR interval. This here is the QRS, right? This one here is the, this one's the most important. This is the ST segment. Good job on FE. And last but not least is this guy down here. This is the QT interval. Okay, and we need to know all these intervals because these, as it turns out, are very important when we're diagnosing certain conditions. For example, prolonged QT is something everybody needs to know about, right? Because we can lead to torsades, which is bad. So understanding that the QT should be under 460 milliseconds is critical. Understanding the normals, okay? And then the ST segment is where we're going to look for the elevation or depression with things like ischemia. Now, I just wanted to give a little commercial for how wrong the machine can be. And so if you're a provider that uses the machine interpretation to tell you what's going on with the patient, and I know a lot of people do that. I did it when I first started because I thought, oh, the computer interpretation, it's a computer. It's got to know more than me. But it's not. It's right about 6 to 42% of the time, or wrong 6 to 42%. That's a lot, right? So up to half of the time it can be wrong. Anyway, this is an example of it being wrong. So what you have here is, yes, trust you, as Tori said. So I want to show you, I got really excited because when I first saw this, I was like, oh my gosh, this QT is 713. And I was like, oh, that's so delicious. That's my longest one. My previous longest one was 671 previously. And I literally was like, oh my goodness, this is so good. So here's a little trick / pro hack, whatever you want to call it. So if you ever see a prolonged QT and you're like, yeah, I don't really know if that's right. Well, here's the thing. Artifact can totally mess up the calculations. So what do? You go over here and you find a T, like you can see this T right here. And you go back to what I taught you about that the T should be close to its dad, right? Now, the test really is If a T is halfway between the R and R, which is right here, if it's halfway, then it's too long, probably over 500. But this guy he's under that. He's right here. So this was actually wrong. It was absolutely wrong. And the corrected QT was actually only 444 when you got rid of the artifact. So if you're ever doing EKGs for any reason, if you're the doer of the EKG, right, make sure you have a clean tracing before you click hit or enter or whatever, capture, print. And if you're the interpreter, know that if there's artifact, you can't trust the interval calculations, okay? So anyway, that was super exciting. So it actually wasn't too long. So do they number the matter at the top of the page? They do. Remy even is telling us, yes, they matter, okay? So I'm going to show you a case where, yes, redo the EKG, Kamal. This was a real case. Ambulance was called. And hey, welcome in, Bonnie. So this was a 51-year-old person who is female who had general weakness. And when EMS got to her door, she said, I feel like the water ran out of me. She had a history of hypertension, psych, and chronic neck pain, for which she did methadone. Hint, hint. That's a problem. QT prolonger, PS. She drank alcohol, QT prolonging, did cocaine, QT prolonging. And for some reason, she didn't feel good. So she called 911. On arrival, she was incontinent. So there is proof that she had loss of consciousness because incontinence, right? And she said she felt like the water ran out of her. That was her way of basically saying, I feel like I'm going to pass out. And so what happened was she got onto the gurney. They assisted her to the gurney because she was like really unsteady. When she landed on the gurney, they noticed that she went into torsades de pointes, which is the lethal arrhythmia. They shocked her. They shocked her. She was pulseless. They shocked her and did CPR, and she returned to a normal rhythm. And this was her door time EKG. So the question when she arrived to the ED was, okay, what do we do with this patient? Do we take her to the cath lab because she technically died? And so they were like, okay, let's like screen the, ST segments, which we'll talk more about on day 3. But in a nutshell, there was no STEMI here. That's obviously the first thing you want to tell, right? But if you apply your rule, I specifically covered up the QT. The QT was actually, I think, 512, too long, right? Over 460. But you can apply your rule here. You can say, okay, here's my R to R. And, that baby looks like he's almost halfway between the R and R. He's creeping way away from his dad. So this was a case of prolonged QT caused by multiple medications, including methadone. Alcohol and cocaine did not help. And she went into torsades de pointes because of her prolonged QT. So she actually needed an ICD. She was taking off all of her QT prolonging medications, and now she's doing better, but she hasn't had any more cardiac arrests because she was taking off all the medications that led to it. So medications can come with risks. There's no free lunch. So whenever we prescribe, we always have to consider the risks, and this is one of the risks. So keeping an eye on that. She got off all her medications. Her QT went down to 441, which was normal, and life was good after that, and she had no more issues. Yay. So just a little preview of tomorrow night, what we are going to ask the 3 questions tomorrow night when we do arrhythmias, okay? And almost all 3 questions can answer your arrhythmia for you. So when we do them tomorrow, I want you guys to ask yourself, is it too fast or too slow, or just right? Is it wide or narrow? We're talking about the QRS, okay? And is it regular or irregular? Because that's going to help you determine who's running the heart. The rate will also determine that for you, which is why I wanted to quickly cover the rate for you so that we're ready for tomorrow, ready to rock and roll. Now, understanding the SA node, AV node, down to the bundles, we talked about that earlier. Let's talk about the rates. So Dana said if someone had prolonged QT in the past, oh yeah. So that's a good question, Dana. In a nutshell, I would basically assess the situation. So the answer is yes. I would if they had a long QT, because you don't ever want to chance it unless here's a scenario which recently happened. A patient had very bad gastroenteritis, was vomiting a ton, gave the patient multiple doses of Zofran, the QT prolonged, they couldn't give Zofran anymore. That's different. One-time thing, medication induced, right? No issues. But otherwise, I would say I would avoid it because ultimately you don't want to be the person that prescribed them a medication after you already had a documented prolonged QT, right? And you gave them that same medication and then they had an issue. So long answer, to a short question, but Dana, you were in our 30-day EKG program before, and I remember you. So welcome back. So going back to the rates, we understand that the SA node goes from 60 to 100. It also, as KJ said, sinus makes P. So let me ask you a question. If you see this rhythm here, if you see this rhythm, what are you missing here? What are you missing? You're missing something. Yes, let's see what we have in the chats. Yes, the P wave, good job. Okay, so what do we call this rhythm? No P wave, but about 40 to 60. What do we call junctional? Good. So who's running the heart? Which one of these guys is running the heart? Ah, Teresa in the house. What's up, Teresa? Yes, the AV node. Good job. We have Alejandra, our student in the house, who's saying the right answers. Love it. Oh my gosh, you're amazing. And junctional, yes, good job. Okay, so then the next thing that's going to happen is when this guy dies, right? You're going to see the next guy take over, which is somewhere in the ventricles. What do we call this rhythm? What do anybody know? This was a hard one. This is a hard one. Idioventricular. Yes, Muna, of course you got the answer. Idio, yes, Tim, Alejandro, Kamal, Christine, everybody got it. Good job. This is idioventricular. We don't know where it's coming from in the ventricles, but yes, it is wide, which is the clue, right? Wide and slow. Hey, Cheryl, what's up? Did you see you were a winner? I don't think you were on earlier, but yes, you were a winner. So I just wanted to say congratulations, Cheryl. And then the last thing that'll happen, right, as you go, things keep dying, what you'll eventually see is this, which is an agonal rhythm, okay? Agonal rhythm is someone in the bottom of the heart, ventricular escape, yes, it's trying to run the heart, but it's not doing a good job. This is called agonal. You will usually not have a pulse with this. Okay, so the paper size, I just wanted to cover that really quick. I think I put that wrong. A small box versus big box. You just need to know that you're looking at 5 boxes is basically a second. And then this lastly for rate, we're going to do later. Tomorrow, this is a good way to do rate if you needed a review. This is something that dropped in the group for review, but I just want to cover it really quick so that if you have a strip and you want to measure it, like if you're on, telly, like I think Teresa is, or if you're, wherever you are, and you need to decide the rate, you can really quickly calculate like this. So you find an R wave that lands on a thick line. Here's a thick line right here, thick, 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 okay? And once you do that, you go over, and the next thick line would be 300. The next thick line would be 150. The next thick line would be 100, meaning if the R wave came here, the heart rate would be 100. If it came here, it would be 75, and it came here, so it's about 64. This is a normal. And also we know there's a beautiful, wonderful P that's not too big, not too small. If she's smooth, not notched, and she's not too close to the QRS, we're happy with that. So that's the rule of 300. And then now we're going to run through our workbook answers. And just in case anybody was like, because I always forget to do this, but I didn't forget tonight. In fact, I was early. I put the answers to these in, in the featured post, the top of the group. So in case you can't read my writing, okay, it's there. All right, so let's do this together. Let's bring out our workbooks, and Tori's putting the link for us in case you want to download it. Let's just go through this together, okay? So number one, the first thing is that we have a P wave, okay? So it corresponds to what is contracting. What is contracting? I know, KJ, I did it so early that I know. So yes, the atrium are contracting. Good job. What about the Q wave? Is it a negative or positive? Is the Q wave negative or positive? Negative. Good. Q wave is negative. And it is normal if it is how much less than how much the height of the R wave. Do you guys remember that? Less than a third. Good job, everybody. 1/3, 1/3. I love it. Strong work. Okay. The QRS, the 3 waves, they represent what is depolarizing. What part of the heart is depolarizing? What part of the heart is depolarizing? Ventricles. Good job. Nice. And then basically, if there is so the rules, if immediately after a P wave, if there's a downward deflection right here between the P and the R, that's a Q. Okay, that's a Q. And then the R wave, is it positive or negative? So does it go up or down? R wave, is it positive or negative? It's positive. Good. Okay. And then the T wave should be a T wave. It should be nice and small, not too tall. And it should be upright in all the leads except for 2. Do you guys remember what they are? All the leads except 2. Okay, AVR and V1, Kamal, yes, KJ, Tim, everybody, you guys nailed it. Okay, good job. AVR and V1. Okay, the answers again are written down for you in the featured post if you want to go over them. So the U wave, it's sometimes seen after what wave? Where do we see the U after what wave? Yes, good, the T. And one of the causes is something wrong with the kalemia. Something wrong with the potassium. What is wrong with the potassium? Yes, electrolyte problem, absolutely. Hypo. Good job, you guys. Okay, delta wave is often associated, we didn't cover this, it's often associated with a short PR interval. And yes, WPW, Teresa. This must be Teresa Como. Yeah? WPW. Okay, so the PR interval is the distance from the what of the T wave to the beginning of the R. That's easy. It's the beginning. And the PR, this is one thing we didn't cover. So put this in the chat for me. If you know it, it's from what to what milliseconds? What to what? How many? Yes, Matt Buchanan, Tim, good. Kamal, I think you're trying to put up there the typo, but yeah, exactly. 120 to 200 or 0.12 to 0.20. Any way you want to slice it. Good job, you guys. Okay, now the PR segment, basically, we kind of already talked about that. The ST segment is what we look for 2 things there, the ST segment, okay? We look for this or this. What's the terms? This or this. Depression and elevation. Good job, you guys. Good job. And then there's also, with ST depression, there's multiple different reasons, okay? Multiple different reasons. So depression can be created by something kalemia, hypo, it's hypo, and then cardiac ischemia. Oh, look at Kamal all over it. And medications, there's one medication that can cause a scooping, one medication that can cause a scooped ST segment. Dig, exactly. Kamal and Matt in the house. Digoxin is something that can do that. So you'll see a scooping of a scooped ST segment. Okay, QT. Long QT can lead to what bad thing? It's 2 words. Twisting of the points is the translation in English. Yes. Torsades de points. And good job, Dana, on the dig. And then R to R interval is to use this to see if a rhythm is what or what. R to R tells us if it is what or what. Regular or irregular. Good job. Oh my gosh, you guys are so on top of it. So that is the session for tonight. We only went 45 minutes, which is yay. This is available to rewatch when we're done. And also we have a prize tonight. So I'm gonna be giving away something pretty magical. And I want to show you what it is. So I'm going to tell you how to win it, and I will be announcing the winner tonight. But let me stop my share so I can show you what's in this good thing. Okay, so are you guys ready to see what the prize is tonight? Are you ready? I know, I'm ready. Okay, so the prize will be given away to one lucky winner, an EKG Workshop Kit. Okay, so in the kit, there is a couple things that make your life easier. First of all, there's some crayons. This is going to be blue, red, and green, because this is going to allow you to color code the EKG so you know what reciprocal changes are, okay, and contiguous leads are, which we'll talk more about on night 3. There's also this juicy workbook here. Okay, there's 17 real EKGs. I'll show you one of them. Oh, I just dropped the part of our prize. This is one of them right here. See, real EKGs, real, no artifact in most of them. They're really good copies here. You could practice those. There's also a 12 lead that we go over. Sorry, I'm getting all the things. There's going to be this tool, which is called the RCAT window. I think I'm backwards. RCAT window, and it has all these cool little like ways to analyze the EKG. That's going to be in the box. Are you so excited? Who wants to win this? And then there's a normal EKG, okay, that you can use to color code. It's normal. That'll be coming to you. And there's also an explanation of how to use the RCAT window thing that you get, an explanation. And then there's actually going to be I can just show you this one. There's going to be a mini painting in the box. Okay, so this one's custom. This one comes on a little easel, but one of the mini paintings, you can see I have paint on my nails. I was painting earlier. I'll be sending you a mini painting. And then last but not least, oh my gosh, last but not least is a cheat sheet. I'm not going to show it to you because it has all my secrets on it, but that will all be in your box. The winner will get the cheat sheet. This is what we give away actually as a gift when you join our 30-day EKG challenge, but we're going to be giving one away tonight. So how can you win? You're going to put a certain hashtag in, okay? You're going to put a certain hashtag in, and I'm going to select a winner and announce tonight. So, ready? It's hashtag 30-day, okay? Hashtag 30-day. Put that in the chat, and I'll be announcing the winner sometime tonight in the group. Okay, so good job. I see everybody in there. And then it looks like I have a question that says, where can I find the answer again? Yes, the answers are in Facebook in the featured post. So if you go to the top of the group, there is featured post at the very top, and it's the most recent one in there. Totally easy. Tori, maybe you can find it and tag Alejandro in it, but tell us your Facebook name, okay? And then we can go ahead and tag you if you can't find it. All right, yes, good luck. So we'll be pulling out a winner. It looks like I got all your, you found it. Okay, good, awesome. And then also, actually, this would be an opportunity for somebody to show how helpful they are if they helped somebody who needs something, also just FYI. All right, so any questions on anything so far? What are we doing tomorrow? While you guys are thinking of questions, if you have any, we'll be doing basic arrhythmias. We'll be doing a little like basic practice after that with Gary, which is not recorded. And then night 3 is the game with Michelle, and then a finale where we go over the 12 leads. So Michelle, did you want to say anything to anybody before we sign off? Or did you see any questions that anyone had?
I didn't see any extra questions. I think we got them all answered, but if anybody watches this later and has any other questions, please feel free to ask. And I will be doing the game on Thursday night, and maybe even introducing Heart on a Stick to show people what the how we teach things in the 30-day.
Yeah, like I said, Michelle's very visual. If you like visual learning, you will love learning from Michelle. So, and she makes it fun. So there's also that. Okay, great. And so thanks guys for being here. I know it's late on the East Coast, so sleep tight, and we will be excited to bring you more great stuff tomorrow. Have a wonderful evening. Bye.